What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for May 21, 2021. COVID-19, kids, and summer, thinking ahead about camps, vacations, and family fun. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Since March 3rd, 2020, Public Health on Call has brought you more than 300 episodes with evidence and experts to help unpack the day's COVID-19 and public health news and what it means for tomorrow. This podcast has been downloaded more than 5 million times thanks to listeners like you. In our final week of Season 3, in partnership with the Johns Hopkins Center for Health Equity, we'll be reflecting in a series of interviews on the one-year anniversary of the murder of George Floyd. We'll then be back on June 2nd with Season 4, and this summer we'll be releasing 3 regular episodes a week, plus occasional bonus episodes. We'll continue to cover the latest on vaccines, treatment breakthroughs, research, and where we are in the COVID-19 pandemic. We'll also cover other urgent public health issues, including gun violence, mental health, climate change, and overdose. We so appreciate all the great ideas that come from our listeners, so keep our public health question at jhu.edu email handy. That's publichealthquestion@jhu.edu. Thank you for being part of this podcast. Today, guest host Colleen Berry, chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, talks with Lisa David, the director of Camp Harlem, an overnight Reform Jewish camp in the Poconos, and with epidemiologist Carrie Althoff. They look ahead to summer, how families can approach summer safely, including in day camp and overnight camp, and how to make sure that our kids, who have been through so much in the last year, have a summer full of fun and joy. Let's listen.
Lisa David, thanks so much for joining us today. And Carrie Althoff, welcome back to the podcast. Carrie, let's start with you. Summer is coming, thank goodness. What a year it's been. All 3 of us have felt the challenges of this very hard year as professionals and also as parents of school-age kids. As a Hopkins epidemiologist, a leading expert on COVID, and a mom, Carrie, can you start by giving us a framework for how we should be thinking about summertime for our children?
So I think everybody really needs to rest and recharge this summer. It has been a very long year. We have faced challenges left, right, and center. We've had a lot of good moments too. Summer is always a time to recharge and reconnect with your family and really make sure your kids kind of have that summertime boost in morale and enjoy some time with friends and doing neat or different activities. So right now, as we're heading into summer, absolutely, we've got to be on our COVID game, remembering that most of our kids and anyone under the age of 16 is not yet vaccinated. And we've got to also be thinking about their whole health as a child, their mental health, their emotional health, and their physical health. It's time to get active this summer.
So let's get more specific, Carrie. Walk me through some of the normal summer activities. Let's start with camps, day camps and overnight camps. How should parents and kids be thinking about camp this summer?
So camps are a huge part of summer for so many kids. They look forward to it. And after a hard year, they're probably looking forward to it even more. I know my kids are. The first thing to think about when you're thinking about camps is, number one, are the adults in your household vaccinated? And that may seem strange. Why is that the first thing we're jumping to? But more and more data continue to show that oftentimes when there's an infection a COVID infection in the household, it's coming in from an adult. It's more likely to be coming in from an adult. And if there's transmission in the household, it's more likely to be from an adult. And so what we need to do is make sure that the adults in the household are vaccinated. And honestly, I cannot understate what a game changer that is for our kids. To have vaccinated parents is really key. And then once that has been taken care of, we can get our kids ready for camp. Choosing a camp that's right for you and your family based on your family's risk tolerance and your family's risk for severe COVID is really, really key. There are a lot of camps that are open this summer, thankfully. There are a lot of different programs, but it does take a moment of pause, as we've done so many times as families over the course of the last year or so, to think about what is our risk tolerance? What can we do? How can we get our kids a great experience over the summer while still protecting ourselves, our families, and our communities?
Lisa, okay, let's bring you into this conversation. You are the director of Camp Harlem in the Poconos. Let's talk about your camp, what you and your staff aim to create every summer for your campers. And let's start with the difficult decision you made last summer not to open in person before we look toward the coming summer.
Great. Well, thanks so much for inviting me to be here to share more about camp. My camp, Camp Harlem, is a residential camp in the Pocono Mountains of Pennsylvania. We're a large camp. We serve every summer close to 900 kids, and we bring about 200 to 250 staff throughout the summer. It's a big community, but we talk often about within that creating smaller communities. And the things that we emphasize are things like character building. We talk about kids being able to be the best version of themselves at camp. We talk about being an open and safe community where everyone feels welcomed and valued and included. And then it's a great experience in terms of engagement and fun because there's lots of activities, there's ways for them to be outside. And very important, I think, for today's times, we get to unplug. So no technology, we're screen free. So it's a great environment for kids to build those personal relationships, but also to build independence and build some new skills by challenging themselves. Last summer, it was indeed a very difficult decision not to operate. We made the decision, I would say, fairly early. It was really the end of April. And throughout the month of March and the month of April, there was endless conversation about how to do this. How could we, continue to prioritize health and safety, but also run our program? And what became clear to us was that there were too many risks and there was so much that we didn't know at that time. We didn't know, for example, would we be able to bring the staff that we needed? Could we have the PPE that we needed to keep people safe? Did we have the medical support from our professionals that typically spend time with us, but were being pulled in different directions at that time? And so before we got too far in planning, we made the decision that felt right for us, which was we didn't want to operate last summer. And others followed suit. Others in our field made that decision after. There are just a small number of residential camps that did operate last summer. And we're grateful for them because there was research done into how they operated safely that's informing how we're planning this year.
Okay, so fast forward to this summer, Lisa. So much more is known about how to keep us safe than a year ago. And we have highly effective vaccines, as Carrie was talking about earlier. This year, you're able to safely open camp. Can you talk about some of the policies and approaches you're putting in place to make camp fun and safe this summer?
Sure. And I appreciate that you included fun because I think what we've also tried to message to families is that a lot of it will remain the same. Those core experiences of fun and connection and community, that will all still be there. We've just put these protocols in place to make sure that it all happens safely. And they're pretty broad, informed, as I said, by the research into camps that operated last year, but also guidance from the CDC and the American Camp Association. Some of them include recommendations about pre-camp isolation for our campers and their families. We've also required all of our staff to be vaccinated. So that's something that's really important to us to help ensure safety of our campers. We're looking at our testing protocols. So right now that includes PCR tests within 72 hours of arrival, rapid tests on arrival, and then surveillance testing throughout at least the first 2 weeks to make sure that there is no COVID present in our camp. We're limiting any traffic in and out. So there's very few people that will be entering our site after we begin our program. And anyone who's entering will also have to follow all of those safety protocols. We're using masks, obviously, pretty significantly as guided by the state of Pennsylvania. So kids, when they're with their cabin, essentially that's their family. So when they're in their home, their bunk at camp, they won't need to wear masks. They won't need to wear masks when they're swimming or when they're eating, but outside of that, it will be necessary to wear masks. We're doing as much as we can outdoors. We've made some accommodations to our facility to make sure that people can be outside as much as possible. We're just really thinking about this as potting in the context of camp. So it's safe to be with your bunk. And then outside of that, we want to be socially distanced outdoors and masked.
Lisa, it's just so great to hear this. It makes me excited for all these kids to have a summer like this. I'll share with you that my son, who's 11, describes sleepaway camp, and this is at your camp, Lisa, Camp Harlem, as the most fun weeks of his entire year. And I don't know a parent who is not worried about their children's mental health and well-being this past year. The pandemic has been hard on all of us, parents and kids alike. Lisa, can you talk a bit about how you're thinking about the summer in the context of kids' mental well-being and how camp fits into that?
Mm-hmm. Yeah, absolutely. And I think in a lot of my conversations with families over the last few months, I've emphasized that I believe camp is exactly what kids need right now. It's been a difficult year for all of us on lots of levels, but for our kids who've been isolated, who have sort of lost some of their social connections and that sort of safety net from peers, who haven't been able to unplug as much as we'd like, camp feels like the right antidote for all of those things. We have an established system in place that we always use to make sure kids were supported and were safe at camp. It includes things like having professionals like social workers and school educators on site. They do intake with families in advance to hear about specific concerns and then train our staff to be able to support kids. We have systems in place for debriefing experiences, for the kids to talk about and process what they're experiencing, but also for the staff to do that. We have lots of ways that we look out for their well-being in terms of tracking their hygiene or how much they're sleeping. And a lot of this is really subtle and behind the scenes and the responsibility of our staff to make sure that the kids are doing okay. And I think we're looking at the unique needs of kids this summer. So for example, the activity level we expect is going to be far different than what they've had over the last year. So we're looking at bedtimes and we're thinking about what programs can we offer and actually adjust in real time if we find that they're just not able to maintain that energy level. So I think more than ever, mental, emotional, and social health is a critical thing that we're looking at. And not only for kids, but for our staff, because our staff are young adults, they're college students, their lives have also been disrupted. So we think that the intensity of a camp experience in many ways can, help them build new skills and feel confident, but also can be challenging. So we have supports in place for them as well.
Carrie, anything you want to add here on summer kids and mental health?
So I think the idea that we have to pay just as much attention to the social and emotional well-being of our kids and our camp staff and everybody else involved in these experiences, as much as we're paying attention to the physical health and the need to protect one another from COVID, is really the sweet spot for what this summer means, right? Especially in the situation where, as Camp Harlem is so wonderfully doing, kind of creating this amazing bubble, right? Where your staff is fully vaccinated, where you're going to have intake that tries to identify any COVID that could be coming into the camp, and then essentially having this space where kids can run around and be kids, camp counselors can learn and fine-tune their skills and create this wonderful safe place for everybody to enjoy. I think that it is important to recognize that all camps are going to do things differently. There are going to be different processes. And one of the key things to do at this point is to learn about not only what are their COVID precautions, and also what happens if there is someone identified with COVID in the camp, but then also what are they doing to support the mental, emotional, and physical needs of these kids, these campers? Because as Lisa pointed out, having a close eye on that is really going to be key. Because I think maybe a lot of camps are not quite sure what to expect with some of these children coming in because it's been such a different year. Hopefully we'll see their resilience, and obviously these camp experiences will help build that mental resilience again for these kids, and honestly just be a time for fun. be a time for carefree fun, which we know helps to rebuild people's resilience.
So thinking about resilience, we've been talking here about overnight camps, but what about summer travel? For many families, vacation travel is an important part of the summer and something that we all look forward to as a needed escape from the intensity of our regular lives. And our regular lives have been particularly intense this past year or so.
Absolutely. So I think, all families need some time to recover. People want to travel by themselves too. That's great. Everybody needs to figure out the best approach for them. And we also need to remember we have a lot of options. And that's a piece of this conversation that I hope doesn't get lost. When it comes to a family vacation or traveling somewhere, you can go perhaps by personal vehicle. If you are really concerned about COVID exposures, you can go to lower risk areas where COVID has a lower transmission rate. There are less state level mitigation strategies and requirements right now. So looking into those things and making sure you're comfortable is going to be key. Trains, planes, automobiles, everything is moving again. Thinking through, okay, do I feel comfortable putting my child on a plane who is unvaccinated? And if you're a vaccinated adult, that answer to that question might be yes. I know my child wears a mask really well. And once we get to our location, we're going to have space from others. We're going to be protected. And this is going to be a fun time for us. Other people may say, no, that doesn't feel right for me. We're going to drive somewhere. We're going to go somewhere into the mountains or to a new kind of geographic location. I know the national parks are probably swarmed with folks. Good thing they are so huge that even when they have big crowds, you can still get some space and some beautiful outdoor air, remembering that the outdoor air really does help diffuse that concentration of virus and really reduces your risk of transmission or infection. So all of those are pretty key features in thinking through what you're going to do this summer. Day camps are another area. Sleepaway camp is one thing where, oftentimes you can create a bubble. Sometimes day camps are not able to create so much of a bubble because day camps oftentimes have working parents, right? And so this is another key area where making sure parents are vaccinated, really encouraging parents of kids at day camp to be vaccinated, and then having those precautions every day when you come in to attest to whether or not your child has had any symptoms or anyone in the household has had symptoms, is undergoing testing, et cetera, is really key. And then, of course, hand washing, masking. And I know a lot of parents are concerned about masking. Most kids are back in school face-to-face at some level, and almost all of them are masked. Kids are pretty good with masks right now. And some parents are concerned that wearing a mask in 90-degree heat when you're running around could be really uncomfortable. Of course it can. If you're running around outside, I've seen strategies where there are instructions for kids to, run away from everybody if you really need a breath, and then take your mask off and take a big breath, assuming you're pretty far away from people, and popping it back on. Remembering that kids are pretty resilient and they follow these masking instructions. Actually, I think much better than many adults. My own kids definitely are fans of masks, even when they're uncomfortable, and they know how to get a break from them when they need to. So all of that is a part of this experience. So I think, kids building their resilience, they already have the flexibility that's been built into them this past year. They've become very flexible creatures. So having the opportunity to have fun is just going to be key.
And Carrie, parents should feel comfortable asking questions to really understand when they're making decisions about where to sign their kids up for the summer, about what those sort of policies and practices a camp is going to have in place would look like, right?
Absolutely. And, asking the camp is definitely one place. I know a lot of camps are putting together a ton of information, and it seems like a fire hose. And it's how else are we going to do this? So the other thing that I think is really important is contacting other parents who are going to that camp, who are sending their kids to that camp, and just kind of rehashing your understanding of the guidelines so that you are sure that you are clear. It does take this added effort as a parent. I think no parent will tell you that anything was easy this year. Everything required added effort this year. And so this is just another step in the process to really understand what's going on at that camp. ask the questions to the camp director, ask questions of your friends so that you can kind of vet your own risk tolerance with different camps. And of course, we do have that framework that we've posted over a year now for families and decision making and thinking through your priorities, your risks, and your benefits from any situation. And that's available on the Hopkins website.
So for both of you, are there one or two things you might say or do to reassure other parents who are feeling nervous about keeping their kids safe this summer? Maybe to you first, Lisa?
Yeah, I think that throughout the last year and a half, I've been really proud to be a camp professional. And I would say as a field, we've really held ourselves to the very highest standards. We do this work of taking care of other people's children because we care so much about them. And so I think we've continued to prioritize them in our planning and have used science and data to inform the decisions that we're making. So people should feel confident in the effort that's being made. I think also it's important for families to remind themselves about why do they choose camp for their child and to sort of weigh that against the real risks and think about the value of building independence, building autonomy, building relationships, and how those things are so needed right now. And can you tolerate and manage, as Carrie said, some of those risks in order to see that incredible impact and to have that value for your child? And the last thing that I would suggest is actually talking to your kids and to actually empower and remind them that you trust this camp and you trust them to follow the guidelines. And so therefore you feel a lot of confidence in their safety this summer.
I have to say a big thank you to all camp personnel, day camp and daycare. Those individuals have allowed me as a working parent to keep working during this pandemic, both my husband and I. So a huge thank you to all of the care and concern, thoughtfulness they have put into their planning. There are still COVID cases in these scenarios. They've been in the scenarios where my children have been. So knowing as a parent how you're going to respond to that, thinking that through before you send your child anywhere is really key so that you understand what your response can be in that situation. That keeps a calm and level-headed perspective on this so that you can continue to support your family in a way that keeps people as healthy as possible. And then finally, just remember when you're choosing these things for your kids, you are the expert in your child's health. There isn't a better expert in a child's health than their parents' expertise in your own child's health. So just remember that you can make these decisions. You've been making them all year as a parent and asking questions and remembering your risk tolerance. I imagine a lot of kids are going to have some pretty wonderful camp experiences this summer.
So on that note, last question for both of you, maybe starting with you, Carrie. We've been focusing on your areas of professional expertise, but as moms, what's the one thing that you're most looking forward to this summer after an incredibly challenging year?
Honestly, for me, it's the pool. Just going to the pool with my kids and just having Friday afternoons. I'm going to try and have Friday afternoons to just relax and play with them at the pool. The pool that we go to has amazing COVID safety guidelines. And that's where we can just have fun and be a family together. And, making the time for that every single week this summer is really key for me. And I'm really looking forward to it.
Oh, I love that, Carrie. What about you, Lisa?
I think the word that came to mind with your question is actually joy. And I think joy is different than fun. To me, joy is sort of this visceral reaction, this sort of overwhelming sense of happiness in that moment. And camp is one of the places where I have the privilege actually to observe that happening all the time when kids are singing or wearing costumes and feeling totally comfortable and free and, accomplishing something that they never would have expected. Joy has been missing from many of their lives over the last year. And so I can't wait to sort of observe and maybe participate myself in some of those moments of joy. I think it's going to be a really, maybe even a deeper emotional imprint because it's been missing for so long.
Thank you both so much for joining me today on the podcast. Summer, here we come.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.